completely clean bill of health.
Oh, well, thank you. The breeding program seems to be doing very nicely all round, doesn't it?
Yes. I think we'll have to keep an eye on those gazelle when their time comes. They could be a bit tricky.
Yes, probably. But they're absolutely essential, you know. They're being hunted to extinction in the wild.
Put them back now, shall I, Mr. Raymond?
Yes, please, Mr. Riley. And thanks very much. You're doing very well.
Oh, no bother, sir. Only wish my own kids were as well behaved. Come on, Chipper, Nero.
You know, talking of children, my daughter's coming home for the weekend.
Oh, Mike, how is she? Haven't seen her for ages.
No, not since the weekend in Holland.
I'd rather not be reminded of that, thank you.
Oh, I shouldn't worry about it. The smell's almost gone by now.
I've just been going over your timesheets. I'm glad to see you're managing to keep your visits to the zoo down to reasonable proportions these last few weeks.
I'll do my best. I imagine we're beginning to show a profit on it, aren't we?
I'll tell you about that when the time's appropriate. Meanwhile, I've got a visit for you that I'm sure you'll enjoy. Another of your exotic friends.
Oh, yes.
A capuchin monkey, no less. Belongs to old Mrs. Crabbe at Hilltop.
Capuchin? And what's the trouble?
Well, she didn't say. And Donald, mind how you go. Mrs. Crabbe comes from a very important family. She's worth the best part of $1 million.
Trust we've not been called to the same patient.
I should hope not. Mine's a monkey.
You're a vet.
That's right. Donald Turner.
Jeffrey Aspinall. I'm a doctor.
So I see. You've come to see Mrs. Crabbe?
That's it. What's she like?
Search me. It's my first visit.
Me too. Mrs. Crabbe's a private patient. Just joined us from Dr. Landau's practice.
I see. Shall we,
I can't say I'm looking forward to this.
No?
By all accounts, the old girl's a bit of a tartar. Landau was glad to get rid of her. He says she led him a hell of a dance. He could never get her to take his advice.
Sounds great.
Dr. Aspinall.
Thank you, Florrie.
Good afternoon. Mrs. Crabbe?
They make these tea bags too big, you know, terrible waste of money.
Dr. Aspinall, Mrs. Crabbe. You asked me to call.
And I'm Mr. Turner, the vet. Shall I wait outside while... I imagine this is my patient here on the billiard table.
Good. Now sit down and listen, both of you. Florrie let you in at the front door. You came through the front door. Now, the front door is never opened. I want that clearly understood. In future, kindly remember to use the tradesman's entrance at the back. Now, I take it you two are doctors. Are you going to look at Thoth first?
Thoth. I'm not here to see Thoth, Mrs. Crabbe. I came to see you about your dizzy spells. I'm your new doctor.
Who's that, then?
I came to see the monkey. Thoth.
You're Dr. Aspinall. What do you know about monkeys?
Mrs. Crabbe, you don't understand. Mr. Turner is here to see your monkey, and I'm here...
Yes, yes, you're his assistant. Quite right. Good. Must have the best for Thoth. Now, you may examine him now, but don't hurt him. You watch what Dr. Aspinall does. You may learn something. I hear he has quite a way with monkeys. Oh, really, Dr. Aspinall? That is Waterford crystal worth 15 shillings and 6p. I shall have it deducted from your bill at the end of the quarter.
I'm sorry. Mrs. Crabbe, do you think it would be best if Dr. Aspinall examined you in another room while I attend to the monkey?
Examined by your assistant? Certainly not. You see to Thoth first, and then you can see to my little problem.
But he is the doctor.
Doctor what, doctor? Is he or is he not a veterinary surgeon qualified to work with monkeys?
No, Mrs. Crabbe, he is not.
Well, there you are, then. I don't mind him assisting you while he learns, but I won't have him messing about with dear little Thoth on his own.
Mrs. Crabbe, I am the vet.
Yes, I know you are. And I want you to know I have every faith in you.
Listen, why don't you look at the monkey and get that over and done with first?
Yes. Tell me, what is it that's worrying you about Thoth?
It's his teeth, Doctor. They seem to be giving him a bit of bother. He keeps holding his face and drooling. And he gets offended very easily.
Offended?
Yes. Our solicitor was here the other day, old Arthur Fairbanks. I don't know if you know him. He only looked at Thoth in the wrong sort of way, and Thoth bit him in the ear, poor man. He bled quite badly.
I see. And how long have you had him?
Oh, at least 45 years.
45 years? Are you sure? That's an incredibly long lifespan.
Oh, at least 45 years. And we had his father before him.
So he was bred here?
Oh, no. I believe he came from Rhodesia or Nyasaland or somewhere
No,
like
I think
that.
you're wrong there. He's a South American species, definitely not from Africa.
No, no. His parents had a ranch or something near Bulawayo, I think it was. I mean, before old Arthur Fairbanks became a lawyer.
Ah, Fairbanks, yes. Tell me, Mrs. Crabbe, how long have you had Thoth?
About 10 years now. And never a day's illness. You may wake him up if you like.
As long as you don't forget old Fairbanks is here.
Thank you.
Now, what are you doing sitting there, young man? You'll never learn anything like that. Go and watch what Dr. Aspinall does.
Tell me, Mrs. Crabbe, has he always moved like this?
Well, of course, capuchin monkeys always walk like that. You should know that. They use their arms only to swing from trees. It's just his naughty toothy pegs that bother him.
Good grief. I've never seen anything like it. There's teeth growing everywhere in all directions.
Yes, I was afraid of that. I think it's a condition known as SAPD, South American Primate Disease.
What's the cause?
Malnutrition, essentially. The head bones soften while the teeth are developing, which allows them to drift off into any old place. The ribs cave in. I'm surprised he hasn't died of pneumonia long since. I'm sure if I x-ray him, I'll find half a dozen pathological fractures of the limbs.
A bit like human rickets.
Very similar in many respects, only more complex.
Poor little devil.
What does he eat, Mrs. Crab? Sweeties, chocolates, that's the sort of thing he gets, isn't it? Sugar lumps, biscuits?
Certainly not. None of that rubbish. Thoth has what I have, plenty of nourishment, just like me.
But what, exactly?
Plenty of eggs in their most nourishing form.
Mrs. Crab, are you telling me he drinks egg flip?
Well, of course he does. We both do. I mean, it's what keeps me as fit as I am. There's a whole meal in an egg, you know, Doctor, and sugar for energy, and grape spirit, nothing but the best. Oh, it's wonderful stuff.
But what else does he get?
You tell me any monkey that's as well looked after as my Thoth is. Avoca's not cheap, you know.
No wonder he can't walk. He must be permanently drunk.
Mrs. Crab, I want you to listen to me very carefully. Now, I know you think you're doing the best for Thoth, but believe me, you're not. Advocar on its own is a terrible diet for him. He's a cripple because of it. It's made him disabled. I'm surprised he hasn't died long since. Mrs. Crab, you are killing him. Now, I can't undo all the damage you've done. I daren't even touch his teeth while he's in this condition. But I think I can help him. I might even be able to make him walk again, on his feet. But you will have to do exactly as I say. All right?
Very well, Doctor. I only hope you know what you're doing.
Believe me, it's the only way of saving his life. Now, I'll give him some Steriger, which is full of vitamin D. And then I'll send you some diet sheets, which you're to follow to the letter. And then I'll come back and see how he's getting on.
I have decided I don't need you to examine me.
Mrs. Crab, I have no intention of examining you. Your doctor will do that.
Examined by your assistant, certainly not. Just stop. I get in. Get on with your examination, but please ask this animal doctor to leave the room while I get undressed.
Hello, Maggie. What on earth are you doing here?
Come home. Oh, Dad.
Come on, what is it? Come on, what's the matter? Come on. Hey.
I'm sorry, Dad. I'm so miserable.
Come on, what's happened? Nigel?
It's all off.
What, the wedding?
Everything. I never want to see him again.
Oh, come on. Come on, sit down. Come on, sit you down. Now, what's happened? Did you want to tell me?
I'm sorry to make such an idiot of myself, Dad.
Oh, that's all right. Come on, you have a good cry.
I haven't cried till now. He's been playing around with other girls. Some of the other nurses.
Oh, dear. Seriously?
Oh, do you call getting another girl pregnant serious?
While he was engaged to you, I'll have his guts for garters.
Dad, I don't want you to do anything.
If that young man thinks he's going to get away with treating my daughter like this, he's got
I
enough...
just want to forget it now. It's all over and done with.
Because the poor girl's terribly upset. The whole world's collapsed around her.
Yes. Hi. Hello, Donna. Hello, Mr. Turner. Hi, Harry. Hello, my darling. That's my special girl, then.
I say, Donald, you couldn't do me a favour, could you? Drop in at my place for a drink and a chat this evening.
Well, if you think it'll do any good.
Well, she's up in her room crying. She doesn't think I know, but...
Well, I'm not sure I'm the right person. She and I didn't exactly hit it off on the Dutch trip, you know.
Yeah, but things are very different then. I mean, you know, you have a joke about it now. I mean, she definitely needs someone or something to take her out of herself.
Yes. Come on, then. Off we go. I've got another patient to see. You're not the only animal in the zoo, you know. Bye, Harry. And you say the back legs have just suddenly become wobbly?
That's right, Mr. Turner. I noticed it a day or two ago. Never took much notice. And this morning it was worse. By this afternoon, it looked as if he was losing the use of them.
The disease?
No, he seems to be all right in every other way. I think it's more likely to be an injury.
How?
Probably playing with the rest of the family. Yeah, what's this?
What is it?
I think he's been bitten, look. You see the puncture marks? About the size of a canine tooth of an adult.
And there's nowhere near his legs.
I think Mum or Dad has probably had a go at him when he was being too boisterous. Eh, Mr. Riley?
Oh, that's quite possible, Mr. Turner. Sheba clouts them sometimes, or gives them a quick nip, you know. Just like to let them know who's boss.
Do you think it's spinal?
Well, if the bite's gone as far as the spine, it could have damaged the nerves, and that would cause paralysis. I think I'm going to have to take him in to do some x-rays.
Right, on you go.
What?
That's it.
Oh, yes. There's the problem, right enough.
Spinal abscess, yes?
Yes, obviously the result of a bite. Probably his parents have dirty teeth. Yes, that would certainly cause paralysis.
We'll have to operate, or it'll get steadily worse.
Can you put it right?
Well, it's not the easiest operation. There'll be a nasty pocket of diseased bone filled with pus that'll have to be removed.
Quite. No reason why the operation shouldn't be successful, though, is there?
Well, it's to be a long job. And he'd need weeks of post-operative nursing. Are you sure your friends at the zoo will agree to pay for it? Is it worth it?
Well, of course it's worth it. If we don't operate, we might just as well put him down here and now.
Well, it might be kindest in the long run. I mean, if we do operate successfully, who's going to look after him? He'll need constant attention.
I wouldn't mind, Mr. Webb.
No, I can't have him staying here, and you certainly couldn't have him in your house. He'll be incontinent for quite a while, you know. No, you've got enough to do as it is.
Oh.
Don't worry about that. I know someone who can look after him. Let's just get the operation done. Leave the rest to me. I know just the person.
Good heavens, what is it?
Well, that is Simba.
But what's that sticking out of his back?
Oh, it's a drain tube.
What have you been doing to him?
He had an abscess on his spine. I had to operate to remove it. And until it's healed, he'll have to have the tube to drain off any fluid.
Poor little thing. He's lovely. Why have you brought him here?
Well, he's going to need some pretty intensive nursing for the next couple of weeks.
Nursing?
Yes, and the poor little thing's got a long way to go yet.
And his back legs may be paralyzed for a while.
And Donald thinks he needs post-operative care. And I think that our stable would make rather a good lion hospital.
With me as matron, I suppose.
Well, I thought it might give you something to do.
And you are a trained nurse.
But not for animals. I wouldn't know where to begin.
Well, the basic requirements are the same as for humans. Lots of loving care and attention. Thank you, Ethel. Good evening, Mrs.
Malloy.
And what seems to be the trouble?
It's his claws.
His claws?
Well, they've got a bit overgrown.
I see.
Well, he doesn't get much exercise, you see.
No, he lives in the house, I suppose.
Aye, behind the bar.
The bar?
Aye. We keep the Weaver's Arms. You know, on the Mossley Road.
Oh, I see. I imagine he's a great favourite with the customers.
Oh, yes, he is. Never as he doesn't try to bite.
Ah. And you want me to clip his claws?
Aye, that's right.
Right, well, I dare say we can manage that if you'd like to get hold of him for me.
Oh, I couldn't do that. I mean, Charlie's me darling, aren't you, love? But he won't let me handle him. He'd tear me to bits.
Well, is there anybody else? Your husband, perhaps?
Oh, no, Charlie hates him. Come to think of it, he hates all men, don't you, darling?
Well, if you could at least entice him out of the cage. I don't think I'm going to be able to manage it with him inside.
Ah, I might be able to do that. He'll probably come out for his favourites, tangerines. He loves them.
Does he?
Yes. Do you know, if I put one in my mouth, he'll hop off his perch onto my shoulder and he'll take it off me. He's ever so gentle then.
And do you have one with you?
Oh, yes. I always carry some.
Good. I'll get my clippers.
Yeah, look what I've got for you. Look at this. Tangerine for Charlie. Let's get him a nice big thing. There we are. Come on, darling. Come on out for Mother. Come on, darling. There's a good boy. Mm-hmm. We are. That's right.
Right. If you'll just keep him occupied there. Here goes.
You little beggar. Get him off. Oh, but do something. He's got his claws dug into his shoulders. Well, can't you grab hold of him or something? He's got me here now.
If you can bear to stay like that, I think I can get to his claws from here.
Well, all right, we'll get a move on.
But my clippers, they've
Well, I
gone...
know where they are. Get them out.
Well, couldn't
Well,
you?
hurry up.
All right. I can't find them. Ah, hang on a minute.
He's got the back of my neck now.
Ethel? Ethel?
There he is.
Doesn't look too bad, does he? Let's have a look. Ah, there, boy. Certainly no worse. Yeah. If anything, I reckon his reflexes are getting better.
Seems quite happy.
Must keep you busy, eh? Looking after him.
It's a pretty full-time job at the moment. Have to bathe him every 2 hours or so with baby soap and water. Stop his bottom from getting sore. That's the danger with incontinence, you know.
Yes.
I think I ought to put something on it. Would a silicone ointment be okay?
Certainly. How's he eating?
No problem there. He's rather partial to a bit of steak tartare.
Who isn't? Good afternoon.
Ah, Dr. Landau, how nice to see you.
How are you, Mrs. Crabbe?
Oh, I'm in splendid shape, as you can see.
And Thoth?
Isn't it absolutely wonderful? A miracle in 3 short weeks. I'd never have believed it.
No more advocacy.
Good gracious me, no. Not for either of us.
That's good.
I haven't had a drop since that nice Dr. Turner was here. He gave me a very thorough examination, you know. Said I was short of protein and vitamins and roughage. And heaven knows what else. He made me have steak and fish every day. And vitamins. I feel absolutely marvelous. Might even consider getting married again.
Very pleased to hear it.
Would you like a drop of this? It's tonic wine, you know, quite harmless. Dr. Turner said that drinking Avoca, nothing else, was giving me my dizzy spell.
No thanks, Mrs. Crabbe. I'll just take a look at Thoth. It is him I came to see, after all. My word.
I thought you'd be impressed. What do you think of that? Hmm?
First rate. Absolutely first rate. Now then. That's good. Very good. If he goes on at this rate, we'll be able to attend to his teeth in no time.
I give him everything you said on the diet sheet. And I've had a little run built for him in the garden. He does so love to play in it when the sun shines. Now, come and have your wine. It really is most wholesome, you know. And then you can tell me what you think of this rheumatic old joint of mine.
Enough of this, I must see. Right, if I go now, I should be back for surgery tomorrow morning, right? Ah, Mrs. Malloy.
They've started bleeding again.
Yes.
His claws.
I'm sorry about that. It's one of the natural hazards, I'm afraid. Mr. Webb will see to him when he gets in. I've got to dash, I'm afraid. I've got an emergency. I've got to see an elephant in Great Yarmouth.
It's the law, I tell you.
And I tell you, I don't know nothing about it.
Then you ought to. Shouldn't he, Mr. A? He ought to know the law.
I don't know. Can you tell me where I can find Mr. Croxley?
Are you the vet?
That's right.
Oh, you'll find him in the fancy caravan, sir, over there.
Thank you.
Now you'll see I'm right. I've seen it before, I tell you.
Donald, thank God you've come.
I came as quickly as I could, but it is a long way.
Yes, I know. I'm sorry to drag you halfway across England, but I need you. This is Mr.
Tompkins, Ministry of Agriculture vet.
Donald Turner, how do you do?
Aren't you the chap who discovered that case of anthrax a few months back?
That's right, yes.
I hope you're not going to make a habit of these things.
Would you like a drink, Donald, or a cup of tea or anything after your journey?
No, thanks, Barty. I think we'd better take a look at the animal first. Which one is it?
It's Gerda. She's in a bad way. I don't know what I'm going to do if she...
Yes, well, let's hope it doesn't come to that. Have you examined the elephant?
No. You're the expert, I understand. I thought it best to wait for you.
Thanks.
I didn't think elephants could get foot and mouth, can they?
I've heard of a few cases having ulcers in the back of the mouth, but nothing confirmed. Is there any foot and mouth about?
Nothing at the moment, thank heaven.
Well, that's something at least. Shall we take a look at her and get her over and done with?
Mr. Croxley! Mr. Croxley, tell him he won't give me my £0.50. Tell him, Mr. Croxley.
I've told you, Mr. Lemon, I don't know nothing about no half-crown. You'll have to go down the station and talk to the sergeant.
It's right, I tell you.
Belt up, Ernie.
I know my rights as a private citizen. If a member of the public discovers an animal's got notifiable disease and goes to the police, he's entitled to a reward of 2 and 6.
Is this right?
I don't know.
Nor me.
I've done my duty. I want my money.
There you are. Now, please, can we have some peace to look at this elephant? Well, at least she's a trained animal. Can you get her open up, Ollie, please?
Yeah, open her up, Hoppy.
Good girl. Yeah.
Well, Uncle, there certainly doesn't seem to be any sign of blisters or ulceration. In spite of all this saliva. Does that mouth look normal to you?
Absolutely, yes.
I knew it would be a wild goose chase. Elephants with foot and mouth.
Well, better check the feet, just in case, eh?
Yes.
Come on, take it to her. Excuse me. Come on. Easy, girl. Easy. Come on. Let's.
I might have known. Nothing.
Looks as though the farm animals of Norfolk can sleep in peace.
Whatever it is, it certainly isn't F&M.
So what on earth is it?
Don't ask me. You're the elephant expert. I've got more important things to attend to. Goodbye. Goodbye, Mr. Croxley.
Bad-tempered so-and-so. More important things.
Well, at least we know it's not foot and mouth. That's something. We won't have to close the circus or lose any animals.
Something, I suppose.
Hoppy, my case, please. You better tell me how this started.
Well, we found her this morning like this, with saliva streaming from her mouth. She won't eat, won't drink. Little Ernie Lemon swore it was foot and mouth and insisted on calling the police.
Thanks, Hoppy. Right. Well, I better have a more thorough look at her. All right, girl. Let's have her open up.
Uncle.
Good girl. Right, girl. Right. Good girl. Yes. That's good. Good. Stay there. Good girl. Yes. Yeah. All right, girl. Steady, girl. Steady. Hey. There's nothing wrong with the teeth as far as I can see. Mouth, throat seems to be okay. Just can't see any obvious reason for all that saliva.
No.
Unless... Hoppy, would you get me a banana, please?
Yes, Mr. Sir.
Come here. Here we go. Thanks. Oh, and would you get me a bucket of water?
Oh, okay.
Come on. Here. Come on. Open up. Open up. I want it in your mouth. Here. Come on, Gerda. Open up. Good girl. Let's have that water. Thanks. What did the elephants have to eat last thing yesterday?
Same as usual. Chopped carrots and apples.
Chopped. Are you sure?
Certainly, You don't think...
I'm afraid so. I think one of the apples didn't get chopped and now it's stuck in her gullet somewhere.
Oh, my God. Where? Where could it be?
It could be one of three places: where the gullet enters the chest, passes the heart, or where it pierces the diaphragm. And whichever one it is, Gerda's in big trouble. Hello? Hello, Maggie? It's Donald. Turner. Yes, I'm in Great Yarmouth with the sick elephant. It's an emergency. It's got an obstruction in its gullet. And I've got to stay overnight to see if it clears itself. Yes. The thing is, it means that I can't give Simba his jab tomorrow. No. Well, look, if I get Webb to leave the stuff out, do you think you could do it? Good. Thank you. It's still there. There's no sign of any improvement.
What can we do?
Nothing. Except make sure she's got plenty of water and glucose, so that if she does try and drink, some of it may get through. Enough to keep her going. She's getting dehydrated.
I don't employ an assistant to go gallivanting off all over the country enjoying himself. When he gets back...
It was an emergency.
Emergency. Everything's an emergency with that young man. Right, come on, let's have the first patient, shall we?
They've started bleeding again.
That'll do for now, Hoppy. So,
Here you are, mate. You look as though you could do with this.
Thanks.
You'd better have this back.
What?
The £5 you gave me.
Oh, no, you keep that.
No, I was wrong. Mind you, I was right about the law. If it had been foot and mouth disease, I would have been entitled. Here. She's not going to snuff it, is she?
I don't know, Annie. I honestly don't know. I don't put it off any longer, Bart. If I do, she's going to be too weak to take any drug. She's going downhill very fast now. What with lack of sleep, starvation, thirst, debility. 5 days is too long.
You're the doctor, Don. We're in your hands.
Well, if I do nothing, she's going to die anyway, so I might as well take the risk. I'll dope her lightly with acetylpromazine, which is more of a sedative than an anesthetic. And then I'll pass a Probang down her gullet and try and push the obstruction through. Right. That's right. More? Good. Go on, Hoppy. Hold her mouth open.
Something wrong?
Hope not. Here, take the end of this, Hoppy. I'm just checking that hasn't gone into the windpipe. No air coming through. So far, so good. Put it right down. There it is. I think it's just about where the esophagus passes the heart.
Oh, my God.
I just have to pray that it doesn't stop the heart. I'll split the gullet and push the apple through into the chest. No sign of any blood.
think it's all right. I've done it.
Donald, you're bloody marvellous.
We're not out of the woods yet. What? I've been caught that way with elephants before. We won't know she's going to be okay until she's come round from the sedative. And that could be a matter of hours.
Mr. Turner! Mr. Turner! Miss Turner! She's out! She's better!
She's up.
Yes.
Made us some hay tea.
Good man. Give it here, I'll do this. It's going down. Quick, give me a banana. Come on. And another one.
Oh, you darling. God bless you, Donald Turner.
Oh, hello, back at last.
Just. I was on my way to surgery, but I thought I'd drop in and see how my patient's getting on.
See for yourself.
Yes. Seems to be coming along nicely. Well done.
Oh, it's nothing really. I'm quite used to being an unpaid nanny, physiotherapist, cook, companion, latrine attendant, and nursing sister all rolled into one.
You sound better too.
Yes. Thanks.
That's all right. I just thought you might like something to occupy yourself with.
Occupy myself. You can say that again.
Well, if you two are both happy, I'll leave you to it.
Do you realise you've been away from this surgery for nearly a week, young man?
I'm sorry, but I couldn't leave while the animal was still in danger.
Oh, and what about your patients here? I suppose you never thought about Mrs. Crab's monkey, or that lion cub, and what about that macaw?
I'm sorry.
Did it? Yes, it did. While you were playing at circuses.
Oh, well, I was hardly playing.
Circuses, it's not as if they ever paid. They're nothing but fly-by-nights and gypsies.
Some of them maybe, but not Croxley Brothers.
All of them. I don't know how you think I'm ever going to recover the cost of all that time you spent on your seaside outing. Perhaps we should count it as part of your annual holidays.
Oh, yes, I was going to talk to you about that. Croxley gave me this for you. Something on account.
Oh, well, something in his favour, I suppose. As long as he doesn't bounce.
Oh, Dr. Aspinall, do come in.
How are you, Mrs. Crab?
I'm as well as can be expected for an old lady of my advanced years.
Very pleased to hear it.
Of course, my dizzy spells have returned. I knew it was only a question of time.
Yes.
But I forget myself. Won't you have a glass of this excellent tonic wine? It's most wholesome, you know.
No, thanks, Mrs. Crabbe, I won't, if you don't mind. I'll just take a quick look at Thoth.
How is he?
Well, he looks fine. Glad to see you've been sticking to the instructions so well.
Oh, he's a reformed character these days. Doesn't seem to get offended nearly so easily. Hasn't bitten anyone for simply ages.
That's good. Well, keep up the good work and we shan't have any more problems with him.
Thank you, Doctor. Thank you for everything. Now, before you go, there's something I want you to have.
Oh, really? There's no need.
Oh, but I insist. Dear Doctor, could you open the door for me? My old wrists, you know. There.